In the fall of 2022, Elon Musk's brain-machine interface company, Neuralink, dropped some major bombshells at their press event. They unveiled two groundbreaking research achievements, one aimed at restoring vision for the blind, and another focused on restoring mobility for paralyzed individuals. Neuralink claimed that even in people with congenital blindness, the visual part of the brain's cortex still exists. By stimulating the corresponding areas on the visual cortex, they believe it's possible to restore sight for the blind. The first-generation Neuralink technology utilized electrodes with 1024 channels, but the company also showcased the next-generation model with a whopping 16,000 channels. According to Neuralink's vision, placing a device on each side of the blind person's brain cortex would allow them to perceive an image composed of over 32,000 points of light. In other words, blind individuals could see more details and a more high-fidelity image. Furthermore, by using mind-controlled typing, establishing a direct pathway between the brain and a computer or smartphone helps individuals with limb paralysis achieve a form of digital freedom. However, Neuralink isn't stopping there. They express confidence in restoring motor functions for individuals with spinal cord injuries, having successfully obtained FDA approval and gearing up for their first human clinical trials. It must be acknowledged that everything Neuralink is doing is rapidly propelling humanity towards a new era of human-machine integration, breaking through the limitations of the organic body. Let's take a look at the process of implanting the chip. The chip implantation process begins with a surgical robot creating an opening in the head. Following that, the skull and the outer layer of the brain membrane are removed, making way for the insertion of a coin-sized brain-machine chip. At the tip of the chip, numerous threads of electrodes can be observed. Each of these threads needs to be individually inserted into the brain to connect with the nerves. The entire process requires the precision of a surgical robot, reaching a level of accuracy measured in micrometers. Finally, the scalp is stitched up to complete the implantation surgery. So, how does this bidirectional brain-machine chip work? Let's take the example of restoring vision for the blind, using the schematic diagram. When the vision prosthesis, resembling a camera, captures an image on the right side, the data is first transmitted to an external device for image processing. The processed data is then sent to the brain-machine chip. Upon stimulation of the electrodes on the chip, signals are transmitted to the corresponding areas on the brain's visual cortex. Countless regions receiving these signals collectively form a pixelated image, reconstructing it in the brain and enabling blind individuals to regain vision. For those with the first-generation chip, the visual experience might be akin to seeing a pixelated image. However, with continuous updates and iterations of the brain-machine chip, increasing the number of electrode threads, the pixelated image perceived by blind individuals becomes more and more detailed. This process represents a remarkable advancement in technology, offering the potential for individuals with sensory impairments to regain specific functionalities through the integration of cutting-edge brain-machine interfaces. Alright folks, let's dive into the nitty-gritty details shared during the conference presentation.
We can stimulate neural activity in the brain by injecting current through every channel. This is important because it allows us to bypass the eye and generate a visual image in the brain directly. In this image, I've highlighted the calcarine sulcus in red in an MRI. It contains a map of the visual world, the visual field. It's about a surface area equal to a credit card on each side. One of the seminal discoveries was that every cell in the visual cortex represents only a tiny part of the visual field. Your perception is made up of a mosaic of tiny receptive fields, each belonging to a single cell in your visual cortex. So if you record from one of these cells in a monkey, say in this location, you can find a very tiny region of the screen where a light stimulus will cause modulation of that neuron. This is a schematic of what a visual prosthesis using our N1 device might look like. A camera, the output from a camera would be processed by an iPhone, for example, which would then stream the data to the device, and the image would be converted into a pattern of stimulation of the electrodes into visual cortex. With 1,000 electrodes, we might be able to produce an image resembling something that you see there on the right.
Another application of the brain-machine chip is to restore mobility for individuals with spinal cord injuries. In a typical scenario, when the motor cortex of the brain sends a movement command, it is transmitted through upper motor neurons to the spinal cord, and then further relayed through lower motor neurons to the muscles. Spinal cord injury results in the disruption of this signal transmission pathway. The brain-machine chip serves as a conduit for signal transmission. In this case, electrodes need to be implanted in both the brain cortex and the spinal cord. The movement signals generated by the motor cortex are decoded layer by layer through the chip, eventually reaching the muscles at the end, enabling movement. Conversely, if the muscles receive external stimulation, the stimulation signals are decoded in reverse and transmitted back to the brain, creating a sense of perception. Integrating these two processes allows patients to regain normal mobility. Neuralink demonstrated this by showcasing a pig with an implanted device in its spinal cord. The principle involves intercepting the brain's movement commands and redirecting them to the legs to achieve specific actions. Similarly, sensory signals from the limbs can also be... Alright, again, let's dive into the nitty-gritty details shared during the conference presentation.
So for persons with spinal cord injury, the connection between the brain and the body is severed. The brain continues functioning normally, but it's unable to communicate with the outside world. You've already heard about how we can use the N1 link as a communication prosthesis to help someone with spinal cord injury control a computer or a phone, but it can also be used to reanimate the body. Let me show you how. If we could place electrodes into the spinal cord, say in a motor pool adjacent to lower motor neurons, we could stimulate those neurons, activating them, and in turn causing the muscle to contract and movement to occur. Here you can see a view from the R1 robot. It's a targeting view, and we've placed electrodes across many millimeters of the spinal cord. And the R1 robot is able to insert those electrodes deep into the ventral horn, into motor pools, in very close proximity to lower motor neurons. This is important because it allows them to have a localized connection to those neurons and activate very precise movements. Okay, so here's a pig walking on a treadmill, and you may have seen something like this before in a previous Neuralink presentation. But unlike before, this pig has more than one Neuralink device. There's a device in the brain, but there's also one in the spinal cord. And we can stream neural data from these devices in real time and use them to do things like decode the movement of the joints of the pig. So here you can see on the left a time series of the hip, knee, and ankle, and we're decoding those movements. So this is super cool, but that's actually not what we want to do. We want to go in the other direction. We would like to stimulate the spinal cord and cause movement to occur. Okay, so let's stimulate an electrode. So here's one electrode on one thread that when we stimulate causes a flexion movement of the leg. So on the left, you can see the movement of the joints, and you can also see the time series of the stimulation pattern in yellow. So the leg is moving up. Here's another electrode, which when we stimulate causes an extensor movement. This is actually a little harder to see because the leg is straightening and the hips are shifting, but if you look carefully, you can see how the leg is moving. We can stimulate on a great variety of threads and produce different movements and actually sequence them spatial-temporally to provide patterns. So on the left, you can see a time series of different stimulation on different electrodes. You can see the movements of the joints. And on the right, we're zooming in on muscle activity that gives us an idea of the kind of strength and power and specificity of those movements as well. So in addition to doing sequences, we can also achieve sustained movement. These are powerful muscle contractions of the sort that you might need for standing or other load-bearing activities and are really crucial for interacting through the world.